Well, let's stay with the questions and issues around health at the moment and take it one step further. Listen to this. More than 30% of cancer patients are diagnosed with depression. The South African Society of Psychiatrists is calling for greater awareness of patients suffering from mental health disorders. This is all being done as we prepare to mark National Cancer Survivors Day tomorrow. It's still one of the biggest killers in the world. Statistically speaking, cancer is the second leading cause of death globally, with an estimated 1 in 6. The most recent stats available here in South Africa are indicating that over 100,000 men and women are diagnosed with cancer. This was just in 2020, so just in 1 year. Well, let's discuss it with Dr. Michelle King, who's made time for me this afternoon. She's a member of the South African Society of Psychiatrists. Dr. King, good afternoon to you, and thank you very much indeed for your time. And I don't think people realize, apart from a diagnosis of cancer, from the physical ailments and everything you go through as a cancer patient, the kind of impact it has on your mental health. Just how bad is it? Good afternoon.
Hi, good afternoon, Gareth. Yeah, I think for so many people, just hearing that they have cancer strikes fear into their hearts. And it's normal then to go through this period of grief, you know, where you're feeling sad or bargaining or being in denial or getting to acceptance. Those are normal emotions, but it starts to become problematic when you become so depressed or so anxious or so fearful that you can't actually cope anymore. You know, it starts to affect your ability to function and your ability to make decisions. And not only that, it's not just about the quality of your life, but it's the impact that being depressed actually has on your the physical illness as well. I mean, if we look at the research, it's actually amazing that being depressed or having a diagnosis of depression will actually even affect your mortality and morbidity. So you've got much higher rates of, or much more severe symptoms, like more, you know, you might feel much more tired, or if you're short of breath, anxiety is going to make that worse. And definitely being depressed could even drive your levels of pain up. So it's not something that one should take lightly. I think it's something that we need to be aware of and that we can get, you know, treatment for when we need to.
Because I would imagine as well that if you're in a state of depression and heightened anxiety, the last thing you want to do is actually get better, even though you may have a cancer that is potentially treatable. Still very serious, not downplaying that, Dr. King, of course, it's all very serious. But it could take away your willingness to get better, which then has a knock-on effect on your family members as well. I mean, there's an entire ecosystem that depression is going to badly affect, never mind just your health.
Definitely, and that's the thing, when you're so depressed, you don't have the drive or motivation or energy to do things. So if you are facing this life-limiting illness where you know you've got a limited period of time, you actually want to be engaging with things that are important. You know, that's spending time with your family and your friends and, you know, doing all those things that you need to get done, whether it's having a bucket list or preparing to make gifts for your children after you're gone. It's all these little things, if you're depressed, you just don't have the energy to do. I mean, let alone the other stuff, like making sure you've got a living will and all those little things that we may forget about, like, have you got a will in place? What do you want to do, you know, when it comes to dying? Where do you want to be? What do you want? Who do you want to be there? You know, and having those difficult conversations about death and you know, how do you want to be buried? Do you want to be cremated? Where must it happen? You know, not being able to have the cognitive ability to think about these things is going to have a lasting impact.
Is psychosocial support just a part of the diagnosis, or are we talking purely when someone gets diagnosed with cancer, here's the cancer you've got, here's the treatment plan, here's how we're going to fight this off, chemo and all these other ways of dealing with the cancer itself? Does the psychosocial ever come into the conversation, or does the patient have to go out on their own to try and find support, or is it part of the treatment plan naturally?
That's such a great question. I'm glad you brought that up, because in South Africa, we've got some really great palliative care teams and some great palliative care providers. But we all, well, not all of us, but many people have this idea that having a palliative care team or having palliative care is only for that last stage when you're actually dying. But you should be having a palliative care team on board with you from the time that you're diagnosed, right? Because those are the caregivers and the healthcare workers who know how to support you And it's not that you're going to be working with them instead of your doctor, but it should be like this other additional layer of support that you're getting. And yeah, those are the people that know how to be giving you that psychosocial support and how to access it, and how to maintain those important relationships in your life. Because otherwise, if you're trying to do it alone, it's scary, and being alone without support is a risk factor for getting depressed. So yeah, you need a team on board with you from the beginning.
I want to just ask from the family perspective as well. There might be someone watching at the moment, Doctor, who's a family member of someone who has cancer. And I suppose, obviously, the most traumatic and the most saddening is any kind of terminal cancer, when there's an actual timeline involved. I've never had that, and I can't imagine how scared the family must be. How do they try, as a family, to get one of their cancer patients, one of their cancer family members, to get up and go and carry on fighting and get out of depression? Because it's as difficult for the family members as it is for the patient. They also just might feel, this is what my loved one wants. They don't want to do anything, and maybe I should just leave them be. What do you tell someone like that who might be watching right now?
Yeah, so I mean, that's the thing. Sadness is normal, right? But being depressed, that you need to get treatment for. Because if you're getting, whether it's medication or getting therapy, that can have a significant impact, right? And often it's just about sitting with that loved one and saying, this isn't you, and it doesn't need to be this hard. We get that it's terrifying, but it can be better. Having a diagnosis of life-limiting illness doesn't mean you're dead now. You've still got this whole journey to go through. And, it doesn't have to be something that you're going to spend dreading every moment. Yeah. You can still have beautiful things happening. It can still be this journey that you get to spend time with the people that you love. So yeah, I think if it's your loved one who's depressed, it's about telling them you're not alone. We can get help for this. There is treatment out there. And just keeping those lines of communication open with your loved one. Let them know it's okay to talk, it's okay to cry. Don't feel that you have to keep everything inside because you're worried that we're going to be sad, or you're worried that we're going to be even more anxious. Not talking about it is what creates that anxiety. Yeah, so it's just about keep talking. And again, it comes back, if you need help as a family member, having that discussion or helping your loved one, palliative care isn't just about the patient, it's about the whole family, whether it's the kids, the grandparents. So those resources are out there. If you're struggling, to convince your loved one to get help, just reach out, and people that know how to help you are there.
Yeah, it's such good advice. Doctor, thank you very much indeed. I really hope it's helpful for someone maybe watching at home or online, wherever you may have seen this interview, that if you do have a loved one struggling with cancer, it's not just their fight, it's your fight as well. Dr. Michelle King, thank you very much. Member of the South African Society of Psychiatrists, just talking about the kind of support that really is available. Just ask. You'd be amazed how many people are there for you.